Welcome to this discussion. Could you quickly introduce yourself to our friends?
Thank you very much. My name is Dr. Francis Mpeta. I'm an infectious disease doctor.
Dr. Mpeta, as an infectious disease doctor, today we are going to discuss HIV, and I'd like you to talk to us about discordant couples or discordancy. For the purposes of this discussion, could you just define what discordancy is or what a discordant couple is?
Okay, so a discordant couple is one where one partner is HIV positive and then the other one is HIV negative, and they still remain married and staying together, and they are also involved in intimacy.
Right. So again, when it comes to discordancy, if say for example someone discovered today that they are discordant, or that they have HIV and their partner doesn't have HIV, what steps should they take?
Okay, so the first step when somebody tests HIV positive, and whether they did it as a couple or they did it alone by themselves, first of all is to inform your partner, and then you actually discuss with your partner that you need to be counseled together.
Right.
So once the counseling is done together, which we call couple counseling, you will actually, be explained to in that counseling session how, issues of transmission and risk for the partner, and then how to prevent, your partner from getting HIV, and now also to remain, free of opportunistic infection in the infected partner. So that's the first step. You have to ensure that you go for counseling. Mm-hmm. The second step is that you now have to see your provider. This could be mostly a medical doctor, or it could be any other allied workers who are licensed to provide ART. Mm-hmm. Then the doctor is going to put the infected individual in that discordant couple on treatment. Mm-hmm. And the other partner who is not infected is also going to be put on some form of treatment for prevention of HIV infection, which we call PrEP. We shall discuss about it later on.
Mm-hmm. Yeah. All right. So is this just for married couples, or just even people who are not married but they find that their boyfriend or their girlfriend is HIV positive?
Yeah. So as long as two people are together and they are involved in sexual intimacy, mm-hmm. and they find that they are discordant, or one partner is HIV infected, these are the steps that they need to take so that mm-hmm. the healthcare providers, from counselors to doctors, will be able to assist them in ensuring that the uninfected partner does not get infected. Mm-hmm. So it's for all people who are involved in sexual intimacy.
Mm-hmm. So the key thing here from your discussion is that the infected partner needs to be kept healthy, and the uninfected partner needs to be protected from acquiring the disease. So what are some of the measures that you take to achieve that?
All right. So the first things, of course, it's very difficult to say using the ABC to tell couples to abstain from sexual intimacy. Mm-hmm. So it's not something that is attainable in most couples.
Yeah. Being
faithful, of course, is very important, even when one is infected, the other one is not, both for the uninfected and the infected, because mm-hmm. once they stay faithful to each other, they will prevent themselves from acquiring a new strain if they happen to have been engaging in other sexual activities. Use of a condom is definitely something that is an option and encouraged, especially for the partner who is uninfected and are not yet on PrEP, or if they are put on PrEP before the PrEP actually can become fully functional. So we do encourage in the early stages the use of condoms as the most effective way to prevent the uninfected partner from getting infected.
Mm-hmm. You talk about PrEP. What is PrEP?
So PrEP basically is treatment for prevention. Mm-hmm. And it's an acronym which means pre-exposure prophylaxis, mm-hmm. Which is abbreviated as PrEP. So what this implies is that a person who is not HIV positive, but is significantly, at risk of acquiring HIV, especially through discordant couples or commercial sex workers, and other people who are involved in different activities that may put them at increased risk. So we actually put them on a special drug, a type of ARV called Truvada, and they take this drug once every day, just as a person who is infected takes their ARVs. Then it depends on which sex they are. If they are male, within 7 days of taking that drug, they will become fully protected. And then if at all they were to be exposed to HIV, the chances of the risk of getting infected is reduced by more than 96%. Then
so PrEP is given to, these are ARVs you give to people who don't have HIV, but they are at a risk of getting HIV.
Exactly.
I just want that clear.
Exactly.
Okay.
So PrEP is not for people who are infected. PrEP is for people who are not infected, but they are at risk of getting HIV infection.
Right.
So it could be in a couple. And most of the times, mostly in Zambia, we are advocating it to be used in discordant couples. It could also be in polygamous marriage, where maybe one of the people involved in that marriage is HIV positive. And then for you to protect the other people involved in the polygamous marriage, they all could be put in on PrEP so that they are prevented from acquiring this infection.
Okay.
So PrEP is quite effective. It doesn't mean that you just take it once. You actually take it every day as long as the risk is still there.
Okay.
So for men, they need to take it at least 7 days for it to be fully protected. So within that 7 days, before the 7 days, they need to use barrier methods like using of a condom. For females, it takes longer. It takes about 21 days for them to be fully protected. So within that period, before the full protection of PrEP, they need also to be using condoms. So after the risk of exposure is not there, then PrEP can actually be stopped. So we've got certain circumstances in which PrEP can be stopped. Number one, if the risk is no longer there. And this risk can mean maybe the breakup of that couple, or the partner was infected, dies, or for some other reason they are effectively treated and they remain suppressed, which we can talk about later as well. Then the risk of acquisition of HIV is significantly reduced, so the person who is on PrEP could actually stop. But it's not something that you stop on your own.
Okay.
You have to be advised by your provider.
So where can PrEP be acquired? Where can people go to get the PrEP?
So PrEP is actually in almost all health facilities that are providing ART.
Okay.
So if you feel you are at risk, you have to visit the health center. The first thing they'll do is, of course, to counsel you, and then they'll offer you an HIV test. And if they find that you are HIV negative, then they are going to offer you PrEP. And then they'll give you instructions on how to take PrEP, and indeed how to minimize the risk. Because as we have said, it reduces up to 96%.
Okay.
If instructions are not being followed as advised, then you can actually end up putting yourself at risk of acquiring HIV.
All right. So, with regards to PrEP, Dr. Mpeta, what's your take-home message?
So, PrEP is very effective. It's treatment for prevention, and it's actually what we are recommending for discordant couples, or even those who are at increased risk of acquiring HIV. So, it's something it's one pill you take every day, and you have to take for a minimum of 7 days for men and 21 days for female, if it has to take, if it has to give you the full benefit. And remember that you follow the instructions as given by the health providers, and that you do not need to start PrEP or stop PrEP without consulting with your doctor.
Dr. Mpeta, thank you for coming through.
Thank you very much.